Alright, so we've just grabbed the bags out of the ambulance as well, and we're just going to do a very brief overview as to what's contained in each bag, in case your paramedic instructs you to grab a bag for a particular job. So our yellow bag here is with our medications, and the nice thing about it is that it has not only the medications but also the IV consumables. So on one side of the opening we've got all of our IV gear, and we have syringes of varying sizes, and you'll learn about which syringe you'll use for drug administration as you go through the degree. It looks quite overwhelming, but this becomes second nature for you as well. Here we have a range of the different medications that we can give, and the nice thing about it as a student is that when you're asked to check a drug kit to make sure that everything is there, everything is labelled in near enough alphabetical order, and you're able to quickly see if there's anything missing here. Now you will notice that some of these tabs have a yellow bit of plastic around them, and it just means that we don't actually need to carry any more of those medications within these slots, but also allows for expansion in the future should we introduce new medications as well. And on the last side we've got our fluids. We've got our inhaled analgesic, which we mentioned earlier as well, and we have a device to provide fluid and medications through the bone marrow as well. We've also got our sticker album, and that might look a bit strange to you having that in a drug kit, but the simple reason is that it contains our stickers for the different medications that we give, and it's really important that we use these as sometimes we're handling 2, 3, maybe 4 medications at one time, and at 2 o'clock in the morning when you're tired, it's very easy to give the wrong medication to the patient. So this allows us basically to ensure that we're providing drug safety, which is one of the fundamental rights that we work under. Next we're going to go over our trauma bag. Back to the side. And our trauma bag is really almost like a first aid kit. Now inside again everything is labelled, we know where everything is at, we can see if there's anything missing. Sometimes you'll see a roll of Glad wrap in here as well, and we use Glad wrap for patients with burns, but also for covering premature babies as well, to help with their thermoregulation. We've also got our CAT tourniquet, and this is used for any arterial bleeding. We also have some cord clamps as well for newborn births as well. Moving on, we have our portable oxygen bag. And inside we have our main cylinder, and we're able to sort of see how much oxygen is in there as well. And on one side of the bag we have our child masks and oxygen tubing as well, and we have our neb bowl for providing medications nebulized, and again you'll go over that later on in the degree. And on the other side we have our adult masks and nasal cannula. Our last bag is our airway bag. And again, this will look quite daunting to some of you. By the end of the degree, you'll know what each piece is used for, and it won't be so bad as well. The main things just to look out for are your OPAs, or your oropharyngeal airways, in case you're asked for that. And again, just moving the compartment as well, we can see our range of bag masks, so adult, pediatric and newborn as well. Now there's a big push within the service for safety, particularly at building sites, car accidents, working at heights, for hard hats to be worn. Now the service actually provides a hard hat for not only the 2 paramedics, but also you as a student as well. Now it's really important that at the beginning of your shift you put this on and you size it just to make sure that it's correct. There's nothing worse than turning up to a job where you need it and then you get out of the ambulance to find that it doesn't fit you. and you're fumbling around as well. At the very back of the hard hat, you'll see this piece of plastic, and it's like a little clip that you can turn clockwise or anti-clockwise, which basically allows for the sort of helmet to get bigger or smaller. And then you have your chin strap. And it's a simple case of putting it on and then just tightening it at the back. Checking the fit and adjusting the chin strap as well. And then you've got all sort of side tags there as well that allow you to adjust the size as required. Okay.